basically, if it were playing, it would basically show that we have a pig on the left-hand side who has a catheter inserted, and with a single push of the button, you have significant EGM reduction, and literally the energy delivery takes a fraction of a second to deliver multiple trains. Now, the important thing is, are the lesions going to be effective? And the answer is certainly with the pulse field ablation that we have worked with, we have seen excellent lesion depth. This is an example of pulse field delivery in the right atrial appendage, which is very, very thick, and you can see here acutely that you can have excellent lesion depth. But it's also very important to know that these are chronic effects. So remember, with irreversible electroporation, you may be able to get acute changes and look like you've isolated the pulmonary veins, but when you recheck 3 months later, all of them may have reconnected. So this is 5-month data in a survival chronic dog model, and indeed we see that we can have significant transmurality lasting well out into several months. In comparison to RF, we see that the EGM reduction and loss of page capture can be very, very similar, but the key point here is really in the safety. And this is an example of how RF can be very, very damaging to phrenic nerves on the left-hand side in an animal model, but you look at pulse field ablation and you see that sort of intact nerve there, despite the fact that we delivered fairly high voltages in very, very close proximity. So you see complete disruption of the nerve with RF, complete preservation of the nerve with delivery of electroporation. This was an esophageal model where basically energy was delivered straight into the aorta, because as it happens in pigs, the aorta are right alongside the esophagus, and we actually put the return ground patch electrode in the esophagus with the intention that all of the energy, like an antenna, would be delivered straight into the esophagus. So if ever you wanted to cause atrial esophageal fistulas or aortoesophageal fistulas, this is the way to do it. And indeed, when we looked at the delivery of RFA, we saw some absolutely horrific changes occurring within the esophagus, fistula formation. One of the animals died early as a result of the fistula, and you can see this incredible destruction in the esophageal tissue. In contrast, you look at the esophagus with PFA delivery, and it looks like it was never touched. So certainly looks very miraculous. You kind of wonder if it's too good to be true, but I would argue I don't think it is too good to be true. And I'll just end off here saying that we're going to be moving to first in human work and hopefully pivotal studies very, very quickly, and look out for the Pulse AF clinical trial. Thank you very much.